My name is Kathy Walker, and I am a committee chairperson for the Student Rural Health Association through Indiana Rural Health Association, and that's who brings us to you today. And UMTRC is under the IRHA umbrella. Students, we hope you're in attendance or will be listening to the recording. This is for you. Anyone that's a student member gets notification of these events and upcoming information about our annual conference that will be June 22nd to the 24th. We are asking students this year to plan to attend on Monday, June 22nd, probably around 11 to 12 o'clock that day for a pre-conference student session. You'll learn a little bit about the conference itself, what's going on, the do's, the don'ts, the app and all those kinds of things. And then we will have a panel of presenters. It's an interdisciplinary panel, some experts and professionals in their field. So we hope that you enjoy this webinar. And if you ever have any questions, feel free to reach out. And take it away, Danielle.
Great. Okay, so let's get started. Real fast, let me take back my hosting privileges. Okay, so hi, my name is Danielle Rankley. I am a program coordinator with the Upper Midwest Telehealth Resource Center. And today we're going to spend some time talking about like the rise of machines in medicine, specifically focusing on AI. And we're going to talk about what that means for our rural health landscape and how we should utilize AI going forward responsibly. So let's get started. Okay, so just our quick disclaimers. We are funded through IRHA from the Office for the Advancement of Telehealth, or OAT. If you didn't know that exists before, now you do. Okay, so quick explanation of who we are at the UMTRC. So the Upper Midwest Telehealth Resource Program, like Kathy said, we are part of the Indiana Rural Health Association. We're a program under that umbrella. However, we are a bit unique in that we don't just cover Indiana. We are also responsible for our stakeholders up in Michigan, over in Ohio, and in Illinois. So Ohio, Illinois, Michigan, and Indiana is our whole coverage area as a TRC. What's a TRC? So we are a telehealth resource center, and we do aim to be kind of your telehealth clearinghouse. So we do telehealth technical assistance. That's our bread and butter. If people have questions, they send those in, we answer them. And that can be through a quick email or through like a long process where we help folks set up a telehealth program. We also have a lot of resources dedicated to outreach and education. And that includes everything from doing webinars like what you're seeing today, as well as podcasts and blog posts, to exhibiting at various places around our region and beyond to make folks aware of the telehealth resource centers. And because we are federally funded, all of the services we provide up to a threshold are totally free to you. So if you've got questions about telehealth, hit us up at umtrc.org. We're also part of a larger nationwide consortium of telehealth resource centers. No matter where you are in the US or the territories, you do have a specific telehealth resource center that should cater to you. But if you contact one of us, you are going to contact all of us, as well as our specialty focused TRCs. We got two of those, one on technology and one on policy. So if you got a question about telehealth, about digital health, AI in healthcare, we would be happy to help you. So just be aware that we exist and know that as a resource, we're there for you anytime. Okay, so during today's presentation, and I do apologize, I'm coming off what I swear is my third cold this month. So I'm a little bit rough, but I love talking, so we'll get through. But today we're gonna answer a couple of questions. So first up, we're gonna start basic. What is artificial intelligence and how is it used in rural healthcare right now? Next, we're gonna talk about what can AI do for the health of our rural residents. And lastly, we're going to circle back to how do we ensure responsible use of AI in healthcare now and in the future? So these are not the only questions I can hopefully answer for you today, but these are the main ones that we're really going to be focused in on. Okay, so starting out with artificial intelligence in healthcare. And this is something I am sure we are all a little bit sick of hearing about AI and everything all the time. I was advertised an AI refrigerator the other day. I have no idea why that's something we would need, but in healthcare, there are a few like novel uses of AI that are really cool and that we are going to talk about. Okay, so what's AI? I assume that we're all passingly familiar with it by now, but essentially it's going to be the ability of machines to perform tasks that are typically going to require more human intelligence. And that can be things like learning, decision making, more reasoning. And obviously, an AI system is not going to be up to where human intelligence is right now on a lot of things, but it's great for certain things we're going to talk about today, particularly things that involve pattern recognition and just like quick processing, that kind of stuff. So 3 main types we're going to talk about. There are a myriad types of different AI systems, AI processing, all of that. But these are the ones that we're going to talk about today. So when we talk about machine learning, and this is most of what you hear about. So machine learning is going to be a type of AI that's going to allow our systems to learn from data and then to make decisions or predictions, less than decisions, based on that data without explicitly being programmed. So a typical program might be programmed to say, okay, if you see red, label it red. If you see blue, label it blue. An AI tool might be able to do things like, okay, I've been shown 100 red images, 100 blue images. If I'm shown a new image, I can maybe say like, that's red, that's blue, or wow, that's purple. That's not something I've seen before. So quick example. All right, so natural language processing, that is going to enable a computer to interpret and respond to human language. So if we think about things like ChatGPT, which I'm sure we all have somebody at our work who absolutely loves ChatGPT, but if you put a question in there, the thing that allows it to answer you in like a understandable way, a human-like way, is going to be natural language processing. So computer vision, that's just going to be like machine learning, but with images. So the red and the blue example is going to be computer vision. And then robotic process automation, or RPA, that's going to be more the AI, the computer that we think of with like automating repetitive, more rules-based tasks. These things can be great for like administrative work, for going through like scheduling, billing, that kind of thing. Oh, and I forgot to mention, if you do have questions throughout this presentation, please put those in the Q&A. I love answering questions, so don't leave those in your brain, give those to me. I can probably get you an answer. So on a larger scale, how AI works, and we're going to use an example here of X-rays. So if I want to create an AI system or an algorithm that looks at a picture of a broken bone, or looks at a picture of a bone and tells me that's broken or that's healthy, I would start by inputting data. I would take a lot of pictures, like we're talking thousands and thousands, labeled pictures of broken bones versus healthy bones, all different sorts. And we're going to put those in. Lots of data for the system to work with. Then it's going to learn from that data. It's going to look and say like, okay, this is broken, this is healthy, I get it. And then it's going to be trained on more images. We're going to show it more images and be like, okay, is this a broken one or a healthy one? And eventually it's going to create, there's going to be an algorithm created where we can show it new stuff. And it's like, okay, that's broken, that's healthy. And we're able to look at the accuracy of those results and be like, okay, this is a good tool, or this tool does not work, we did something wrong, let's go back. So a good system, a good AI program or algorithm is one that does improve over time. So the more data that you're showing it, the better it gets at doing its job. So long and short of it, that's what it is. Okay, so who's using AI? Everyone is the long, the short answer. But we see it in daily life for billions of people around the world. So we see it in smartphones with like your voice assistants, social media. AI is going to be the thing that curates your feed, filters content, the algorithm that shows you all of your TikToks or whatever. That's an AI. And then email has been using AI for a while now. Things like spam filters, auto replies, that's an AI tool. We've got navigation and healthcare apps, as well as things like banking tool apps and tools are going to use AI for things like fraud detection, chatbots, credit scoring. There's a lot of places where AI systems are being implemented, more than what you think of. There was a study I read recently where less than, I think it was 30% of folks could correctly identify like everywhere in their life where AI was being used. So it's a lot more expansive than most people think, even those of us who do work in this space and do know what's up. So over 4 billion folks, over 4 billion people are going to interact with AI powered tools every day. And like I said, oftentimes that is without realizing it. Okay, so brief timeline of AI in healthcare. I'm sorry, I'm trying to keep able to talk. So the birth of AI is a lot earlier than folks think. That was back in like the late 50s. So coined as a field, as a term at a Dartmouth conference. And so there was a medical relevance to that pretty quickly. So it sparked early interest in like diagnostic reasoning. And that's something that's continued to this day. Healthcare is a high consequence field, which means when there's a new technology, we're going to try to implement it there because there's a lot of good that new things can do a lot of times in the healthcare realm. And then we saw it being utilized on and off throughout the next however many years. To diagnose blood infections was one of the first usages. It wasn't adopted due to a lack of trust, and also there were legal barriers, usability concerns, and that's going to foreshadow some of the barriers we still face today. And then we saw the rise of machine learning, deep learning, and those just allowed these algorithms, these machines to do more and more to where we are today, where generative AI and large language models are being utilized in clinical practices. And something I will hit on pretty hard, but I'm going to start here, is that AI should never be thought of as a replacement for a provider. It's always going to be a tool to augment, not a resource to replace. So as we're talking about the usage of AI and how it's moved forward, we can't think that it's something that can just replace, all of the skills that our physicians, our providers already have. That's not its role here. Okay, so where do we see AI being utilized currently in our healthcare landscape? Okay, so first, and this is the one that I personally think has the most promise, is in administrative tasks. If we can utilize an AI tool to cut down on time for providers and their staff to do things like scheduling, chatbots to answer common questions and to do like light triage, that kind of thing, to do note-taking, translation, and then, like I said, AI is great at recognizing patterns. So being able to cross-reference previous appointment notes, that kind of thing. That's where AI can really shine in our current, healthcare landscape, and also in its current iteration. AI, there's been a lot of hay made about how it's going to advance, how it's going to get better and better and better. But let's think about where we are right now. Administration is a good place for it right now with the capabilities that we have. Okay, so diagnostics is more of an emerging one, but we have seen promising sort of usage in the fields of radiology and cancer identification. And it should be human and AI tools working together. It needs a human element to work, and AI should never be left to make any final decisions. That's gotta go before a human, but we have seen lessening of like misdiagnosis when AI tools are being used to like check your work kind of. So that's good. That's a good outcome. Okay, some different uses for different AI tools. So machine learning, we talked about earlier, that's something where we see the usage for patient triage or outcome forecasting. So an example of this, at a local health center, we can see machine learning used to flag patients who are at risk for for like diabetes or other chronic conditions using basic health screening data. So if we have this health screening data, an AI tool can flag those that like maybe have like a certain set of conditions that they've met. So we can follow up with those patients and try to work towards lessening their risk for developing prediabetes. So this is one way that we've seen machine learning be used pretty effectively. Natural language processing. In rural settings, we've seen this used for voice assistance, language translation, and then chatbots for patient education. A language translation can be a really helpful one, especially we've got a couple larger Haitian Creole communities. We don't necessarily have an easy translator available for those, but if we have a natural language processing tool, an AI tool, to be able to help with that language translation, that can be like a lifeline. And a lot of times these things are not going to be, and this is something I emphasize with telehealth as well, this is not going to be the ideal way that this information is being delivered, but it is much better than nothing. So we've got to think of it as a resource there. So computer vision, this can be something that can help like diagnose skin conditions via smartphone photos or like an app, and also analyzing x-rays remotely. It can help when there's a lack of specialists. So you can use an AI tool to be like, is this something weird? Should I follow up on this further? So we've seen usage of that, and we'll talk about a study that saw some of that in a couple of slides here. And then last but not least, the robotic automation or process automation, that is going to be helpful for things like scheduling, supply chain management, medical records. So a bot can be utilized to reduce clerical burden, which is great. Okay, so like I said, just last summary of the places we're seeing it used right now in rural health. Optimizing telehealth is one. Helping with like process flow, doing predictive analysis, which I think is something that has a lot of promise, providing clinical support if you don't have a specialist, and then doing more administrative automation. So this is not all of the ways that AI can be used, but it's some of them that we're seeing, and it's some places that we are seeing promise. In rural health and in the larger healthcare system. So, because we're all having we're all having provider shortages. So any way that we can lessen burden on provider and make healthcare more accessible is good, as long as we're doing it responsibly. Okay, so now that we've talked about some of the basics of what AI is and where we are utilizing it in our rural settings, as well as just overall, let's talk about some of the potential. And I know I talk quickly, it's because I have a lot of slides and I want to get through them. Okay, so here are some things that I have heard actual people say to me in my role as a program coordinator for the Upper Midwest Telehealth Resource Center. So AI will replace all of our doctors, a real thing said to me by a medical professional. Rural health problems can all be solved by AI. Smartphone apps can replace a therapist. This is something that was said to me by, I think, my brother-in-law. So these are things that people have, these are sentiments people have. And we need to talk about them and address them, because they are not true, unfortunately. So we need to be able to manage our expectation. And a lot of this particular section is going to be talking about the management of expectations and how we can do that to ensure that we are not overly reliant on the promise of something that is never going to actually get there. Okay, so let's talk about the hype. Why is there this big hype around AI right now? So first of all, the media is like, the headlines in AI do stoke interest. So it's going to continue to be, promoted. A lot of that's because of AI algorithms. So it's feeding into itself like a fun Ouroboros. But the promise of AI is largely being presented as infinite. It's something that it's never going to slow. It's going to continue to be at the forefront of everything we do forever and ever and ever. So there's a lot of perception out there that it is just everywhere and everything. that is being pushed by the media, and the industry does, like, they benefit from that, so they're not going to fight that, because billions are being poured into AI startups and tools. It is a massive part of the healthcare industry, but also industry at large right now. Healthcare and technology as well, that's an intersection that's going to carry a lot of weight. Like I said earlier, healthcare is a high consequence field, and it's also something that touches everyone. You're never going to get through your whole life without interacting with the healthcare system, no matter where you live. So it's something that's high consequence, high visibility. And then we are seeing rapid advancements. I don't want to discount that. The advancements in the AI space are happening quickly. It's exciting. There's a lot that can be done here. So that, and then everything that's being piled on top of that, means that there is a lot of hype here. And so the public is seeing all of this being presented to them, and they're looking at it as an easy solution to a complicated problem, which can be can be untrue. And so we have people who assume that AI can solve all of their health problems, and that's obviously not true. And it's going to offer solutions to shortages. So there are a lot of people out there who cannot find a general provider, who can't find a therapist, who can't get into a specialist for months and months. And if they're being told that AI tools out there are able to solve those problems, then obviously that's going to be something that they're going to want to invest in, you know? All right. And then there is a general lack of literacy around tech. Either it's a scary thing and we don't want to touch it, or it's amazing and it's going to solve all the problems. So I don't want to come off as like a big pessimist or a big downer, but I am a realist. So it's important to understand the hype, why it's happening, and why the perception might be shaped in this certain way, you know? Okay, so let's have a reality check. What can AI do? What things can it do for us? So its big thing that it can really help us with is enhancing efficiency. We can reduce time spent on administrative tasks. We can engage with patients outside of traditional office hours with AI tools. We can automate our scheduling, our documentation, make things easier for everyone. It can also improve outcomes. I don't want to discount that. It can support clinical decision-making and flag those who are at risk for certain things, because it's great at pattern recognition. And that can be like a lifesaver for folks. It can also help with disease detection, and can also monitor patient data and identify abnormalities, so we can proceed with medical interventions quicker, lead to better outcomes. It's great. So AI can augment provider capabilities, not replace them. Important to remember. Okay, so here's a real world example that I read in a study recently about where AI is doing really great work. I am sorry, I keep having to stop to drink. Okay, so AI for tuberculosis screening in rural India. So the problem that we had here is that there are a lot of remote villages in rural India. We're getting really rural here. But there are a lot of remote villages there that are going to lack access to certain types of specialists, quite obviously. And one of those specialists include radiologists to interpret chest x-rays for potential tuberculosis, which is something that can be quite dangerous and can also spread through a community. So the solution that was put forward with like AI tools was to use an AI-powered tool to analyze those digital chest x-rays on site in these communities, and then flag those that had signs of tuberculosis or signs of something not being normal, and then to push those onto a remote medical team. So there's also telehealth being utilized here. Love it. But they're going to capture these images from those portable x-ray machines. The AI software analyzes it, and then it forwards on ones that look high risk to have a specialist look at them. So it turned out to be pretty successful. So AI identified about 16% of additional cases that just radiologists had missed. So that case detection was increased. We didn't have to have specialists there like looking at these things, and that was going to take a long time to get specific radiologists out there. So this is a way that we saw an AI tool used in a really promising way in a rural setting, which is great. Okay, so moving back to our reality checks, let's talk about what AI can't do. So first and foremost, and I've said this a dozen times already, but AI cannot replace providers. First and foremost, there are ethical considerations that need to be made. AI is not something that can take responsibility for its decisions, so it should not have final say on a decision that has to do with a patient's health outcomes. Those are obviously very important, and so we want to leave those in the hands of a human person. So AI tools, those are just tools. Tools can enhance your ability to do things like significantly, but it can't replace people. And it also can't make context-aware decisions. It's going to lose outside context that sometimes can change what data really means. And AI tools, it's important to know they're not perfect. They can and do make mistakes. And we're going to talk a little bit about systematic issues when building AI tools. But right now, there could be biased data coming in. And if there's biased data coming in, there's biased data coming out. And just because it's a machine doesn't mean that it is removed from the bias of its creators. And also, they don't exist for every situation. If I have a rare disease, obviously there's not going to be a lot of data out there to train an AI tool on. So I can't benefit from this. So they're not going to exist, so they can't replace provider, you know. Okay, so here's a real world example, and this is something I saw in real time because I did work at the Indiana Department of Health in emergency preparedness before I was at my current role. But COVID-19 chatbots, they were not able to be utilized. They're AI tools. They were not able to be utilized effectively during COVID-19. So during the COVID-19 pandemic, health systems became overwhelmed. And these were hospitals, doctors' offices, public health departments, state health departments. I saw that. So the solution that was proposed was that there were some health systems, some public health organizations, what have you, that did implement AI chatbots to answer questions. So it did not work effectively. And why it didn't work is because those chatbots were often giving outdated information because they were getting their information maybe from reputable sources on the internet, but unfortunately that data was changing really quickly. And we were less developed in the AI space back then as well, but it was really hard for them to comb through and for this data to be up to date, to be accurate. Guidelines were changing. Guidelines were different for different populations. So some of these tools failed to recognize urgent symptoms or potentially high-risk cases. And if they were to follow that, like the advice given or the information given, that could be dangerous because it was not accurate. So some of those chatbots were going to provide outdated or even harmful information. One study did find that around 30% of chatbot replies to health questions could cause harm, with around 16% of those replies potentially resulting in death if acted upon. Not that they were necessarily acted upon, but looking at the data, if they were acted upon, around 16% could potentially really result in death, which is very dangerous, obviously. But this is one example of where chatbots or AI tools were not correct for the situation, or the ones being utilized were not effective. And it's important to note that there are going to be situations like this where AI is not the solution, or if it is, it might not be being implemented in the right way. Okay, so some of our key benefits here, and I talked about this earlier, it's going to increase access to care, particularly in areas where we don't have a lot of care available. My first example from rural India, it worked so well because that was a place where there just was not the access there. There weren't the specialists there. So utilizing AI tools was helping to bridge a gap that existed. It can also lower the cost of services if you're cutting back on your admin work, if you've got more access to these tools, if you're able to use these sort of care planning things where you can have earlier interventions, where you can identify health risks earlier, that is going to reduce your cost of service. And go along with this next point of being able to enable proactive care. AI tools are really great for monitoring like people with diabetes, people with hypertension, people with other chronic conditions, things that are going to need to be regularly monitored, and then interventions are going to need to occur if certain things happen. So it works really effectively in tandem with remote patient monitoring tools because that can provide a wealth of data. And if we can utilize an AI tool to monitor that data and flag a physician if there is abnormal results or a trend that's like troublesome, we can react sooner, and that's great. It can also assist non-specialists. If you're working in a rural clinic, you're the only provider there, you don't have specialty in a certain thing, you can utilize AI tools to provide information and help guide you and figure out, okay, I got to bring in a specialist from here, but what is things I can do until I'm able to get this person to a specialist, until I'm able to contact a specialist. So it can work as a stopgap that way. Okay, so where are our uses in rural areas? Where are those most practical? So our more complex uses, our diagnostics, our triaging, our combing through data, a lot of those are still being studied and considered. So administration, that's something that we see and we're like, oh, that's immediately practical. We can use it to help with scheduling, billing, note-taking, chatbots. Those are things that if there's like a screw up, it's probably not gonna have serious consequences. So places where we can immediately utilize these tools, and it can cut down on provider workload to allow more patient care, which is what we need, particularly in this landscape right now where we have such severe provider shortages, particularly in our rural areas. Okay, so what are some of our potential barriers in our rural communities to utilizing AI tools? So there's going to be a limited access to the internet. I can and have done whole presentations on the importance of broadband, on the importance of internet access. There's a lot of folks now who call it like a super determinant of health because it is going to affect your health. It's going to affect where you live, work, play. It's huge. So there are places, particularly rural places or very geographically isolated places, that are not going to have that robust internet access. And if they don't, a lot of those AI tools, a lot of telehealth largely is going to be outside of their reach. And there are things that are being done to mitigate this to an extent. Alternative telehealth access points is a good example. Things that rely just on mobile connections. Granted, those aren't everywhere either. So there are ways that we mitigate this challenge, but it's going to be one of our most significant just because it still exists in so many places where we just don't have reliable broadband. And even if we do have reliable broadband, it is not going to be high speed. It's not going to be dependable. It's not going to be affordable. So there are a lot of reasons why people don't have access to this, a lot of reasons why it's a problem. Like I said, I do presentations on this as a super determinant of health, but I'll move on from that right now. Language diversity can be an issue as well. So if we are utilizing an AI tool to help us with translation, it doesn't necessarily have accurate samples of every language out there. There are a lot of them. We don't have good resources for every different language. Like I said, Haitian Creole, we have larger Haitian Creole populations in certain parts of Indiana. Some tools can work with them, others can't. So it's important to know if you're utilizing an AI tool with a certain population, does it have accessibility for the communities I'm working with? Not everyone will. In fact, a lot of them won't. So important thing to be aware of. The infrastructure and funding around AI is a huge one. So utilizing some of these tools, it can be very expensive. The infrastructure doesn't already exist, so it's got to be built in a lot of cases. And the funding, there are ways to work with funding if you're like a large hospital in a large city. But if you're a rural hospital, a critical access hospital, in a rural community, a lot of times there's just not going to be the wiggle room in the budget to make this work. Not to say that hospitals in large cities don't also have budgetary issues, but it's going to be really exacerbated in our rural areas. And then last but not least, this is the one that I think is really important to keep in mind as we talk about the utility of AI. Trust and ethical concerns are going to be really important to consider, because when we are putting decisions in the hands of a computer, who is at fault if something goes wrong? The person who utilized the computer, the person who made the tool. There's a lot of things that we're going to have to reckon with before we move forward with using these things more widely. And I don't think we've come up with any definitive answers, and perhaps there aren't definitive answers, but there is an intersection with this in legality as well. And we're going to talk about that here. Maybe next slide, maybe the slide after. Okay, one more thing to note, and I discussed this last slide, but the digital divide, that is going to be our big barrier. We don't have the infrastructure in our rural communities. We lack the technology access. So beyond just having dependable high-speed broadband that is affordable, some folks don't have smartphones. Some folks don't have computers. It seems impossible, but it's true. And that's going to be true of rural clinics, rural hospitals. They're not going to have the most up-to-date computers that can run all these softwares. They're not going to have like the latest and greatest in infrastructure. It's just not there. So they may not be able to access technology, even if it would be helpful. And then patients may lack those internet-ready devices. Digital literacy, there may be low digital literacy in patients, but there also might be low digital literacy in providers. So it can be a situation where people need training, people need information, and it may be hard for them to get their hands around what they need to do with AI and how it can be useful. It might be hard for them to trust it. So digital literacy is a big barrier. And then talked about this last slide, but affordability, there's always going to be affordability issues when we talk about rural health, but with new technology, with new health tools, that can be something that is a problem. Okay, so a few other rural specific challenges. I think it sounds like I'm all doom and gloom, but it's important to note the challenges so we can figure out ways to overcome them, because the ways are there, I promise. So access specifics are rural challenges. Specialists might not be available in our rural communities. We have workforce shortages. We have lack of infrastructure. Our populations in rural communities, and this is something I haven't touched on yet, there's going to be higher rates of chronic illness in our rural communities, higher rates of poverty, and higher rates of digital illiteracy. So the challenges that surround, the health challenges that surround rural folks are different and sometimes more severe than the health challenges that afflict those in more urban or suburban communities. Cost, last of all, in our rural populations, there's going to be higher uninsured and underinsured populations. Our clinics, our hospitals, our health systems, those are going to be operating on narrower margins generally, and they're going to have a greater need for positive ROI, and also to have positive, I'm acronyming, return on investment. So there's going to be a greater need for positive return on investment, and it's going to be needed quicker as well. Okay, so how we use AI to mitigate some of these things. There are the availability of AI tools out there to help connect with specialists. They can also relieve administrative burdens. With our populations, I mentioned this earlier, but RPM, remote patient monitoring, and RTM, remote therapeutic monitoring tools, are very helpful to folks with chronic or long-term conditions. And AI tools can help monitor that data without taking a ton of time away from providers. So staff should be trained on that, and they can hopefully integrate in the community with that. And then AI can potentially be a cost-effective solution with the ability to provide quick return on investment. So, okay, so how do we take action here? We've identified that AI can be very useful for our rural communities in certain circumstances. How do we move from knowing that to actually utilizing it? Let's talk about it. Okay, so just a couple of action steps. First, and this is true of implementing any new technology or process in a clinic, in a hospital, in whatever sort of healthcare facility, whatever you're working with. You need to conduct a sort of assessment or an audit of current digital tools, workflows, and infrastructure being used. How does everything work together? Where are we hitting inefficiencies? That's the first thing. So where are we hitting bottlenecks? Where are things inefficient? Where can we improve things? So we've got our assessment in front of us. We have our workflow. We know how stuff works, and we know where there are issues. So we want to, this may sound different from most folks who are like, start big, but no, we need to start small, and we need to be smart about how we start. So it's a good idea when we're utilizing a new tool or a new like AI tool to choose one area to pilot. It's going to be really hard to track efficacy if we're saying, okay, we're fixing everything at once. No, pick one area where there's a bottleneck, where there's an inefficiency, where we just want to try something new and implement an AI tool. So automated appointment reminders are a good example of this. If we're losing a lot of time sending out like email, or if our system is inefficient for that, or if we want to try to use it for clinical documentation support. This is one area, and we're going to use AI here. So it's helpful if we focus on a use case that has clear return on investment. So if we've got a staff member who's spending like, I don't know, like 4 hours a week or whatever, sending out these appointment reminders, that's a good use case because we have a clear metrics. We can say, okay, this is the amount of time that we have, and we want to reduce that amount of time. So after we have identified like, okay, this is what we think we want to do. Teams need to be engaged. Large teams need to be engaged. Small teams need to be engaged. Everybody needs to know what's going on. It's a lot easier that way because folks are invested in the process. So staff should be trained with simple role-specific materials. And then staff, it's helpful if they're included in decision-making so they can feel good about what's happening. And then it's important with staff as well as with patients to say, okay, the AI being used here, it's not going to replace people. It's helping people do their jobs. My favorite thing that I've heard folks say is that your job isn't going to be replaced with AI. Your job is going to be replaced with someone who knows how to use AI. And I think that's really true in healthcare. So you should be engaging folks so they can all understand what's happening. Okay, next up, we want to leverage our partnerships, particularly if we're very rural. Collaborate with our community partners. If there are existing pilots or grants that are happening, try to collaborate on those. It's great if you don't have to pay for everything just yourself. And then last but not least, well, not last but not least, second to last but not least, we want to ensure that we're prioritizing security. AI tools need to meet the same HIPAA standards that any of our technology does. And yes, telehealth platforms, AI platforms, they need to be HIPAA compliant. And then we need to develop clear policies on AI usage. Where are we using it? And we need to let our patients know. Patient consent needs to be gathered if we're using an AI tool directly in their care. That's important. And then we want to measure and adjust, the best part of any sort of action plan. We want to collect our metrics, see how is this working? Are we having positive impacts here? Are things changing for the better? Or, oh no, are things changing for the worse? And then based on those metrics that we're getting, those results, we want to move forward and either pivot away, like, okay, let's talk about why this didn't work. Let's try something else. Or scale. If this is something that we went from staff spending 4 hours a week on this to half an hour, great. Let's implement this for more stuff. Let's get more staff on this because it's something that we want to scale up because it worked well. So those are the action steps that we can take. They're great for implementing AI technology as well as any new like telehealth technology in whatever size of practice, clinic, whatever you're working. All right, so is AI going to be too expensive to utilize? In some cases, but not always. Obviously, you're not going to be able to build a new like AI data center next to your local rural health clinic, but we can utilize these tools. Many AI tools are available as part of existing softwares and can be added on for low cost. nonprofits and small clinics sometimes can get cost reductions. So investing in simple AI tools as well means that like we can just plug and play. We don't have to invest in a whole bunch of new staff or anything. And then we can always explore alternative sources of funding. Like I said, grant funding, there's frequently nonprofit pricing, and then partnerships with folks within the community or large scale partnerships with folks within like the country, the state, what have you. There's a lot of options here. Okay, so again, just quick graphic of what we talked about. Identify a need, choose a tool to meet that need that's appropriate for your situation, pilot the tool, evaluate the impact of the tool, and then scale based on that. It's pretty simple. Obviously, it's going to take time. It's going to take engagement. It's going to take effort. But the process itself doesn't have to be super complicated. Okay, so how do we enable that our AI use is sustainable? Because we can employ a fancy new tool, but if we can't sustain it, then that's less than useless because it's taking away our time. Okay, so healthcare providers need to be trained. They should have basic digital literacy. We saw a lot of this in the COVID pandemic. Not every provider was digitally literate. Not every provider could comfortably move to telehealth. And that's true of AI tools as well. And then it's important for providers to recognize when do we trust our AI tools and when do we trust our own judgment. It's important to have that discussion to be aware that sometime will need to happen. Patients should also be educated and supported. They should be made aware of what AI does for us and what it doesn't. And then they need to consent to what's happening. And there should be mobile and offline friendly education tools because not everyone has a smartphone. That's important to note. Or not everyone has a computer, excuse me. All right. And then last but not least, community health workers. So we talk about the increasing role of community health workers, particularly in our rural communities a lot, because we are seeing more utilization of digital navigators, community health workers serving in that role, where they are able to help folks in the community become connected with digital resources that are out there. Like I said, there is a large discussion around how much broadband affects our larger wellness, our larger health. Community health workers and specifically digital navigators are a great tool towards making sure that everyone can be engaged and online. Oh, and something to mention, training's not going to be a one-time thing. As we invest in these tools, telehealth tools, AI tools, what have you, training needs to be continual. New folks will come on, folks will leave. And it's always good to just have like an update to ensure that folks are using the tools in a responsible way, because all it takes is one screw up to maybe make something useless. Okay, so it's important to be responsible, and this is part of the way that we ensure that AI is utilized responsibly going forward. So there's going to be a lot of sensitive patient data out here when we're talking about utilizing AI tools. So rural locations need to ensure that patient data privacy is being respected and upheld, that there's informed consent and transparency, that their data ownership is clear, and that bias and fairness, that the tools that they are using are as unbiased as they can make them. So something to think about, AI tools are frequently going to be trained on data from urban, wealthier populations that may not perform well in rural or minority communities. Good example of this, it's really large, but there was an AI tool for health that was created a few years ago. They were not getting accurate results and couldn't figure out why. And then they looked about the data that had gone in, and it was only on male patients. There were no female patients on the data that was being put in. So obviously, when you neglect half the population, the data that's coming out is not super accurate. So that's a pretty large blunder, and most folks wouldn't make it these days. but subtler things like where a population is from, what their like income looks like, what their insurance status is, things like that are going to affect the results that come out. So being aware of that is important when we're considering utilizing AI tools. Okay, so how do we utilize this responsibly? It is important for us to have clear privacy protocols and consent protocols. There needs to be an ethical review done of AI tools before deployment. Is this an accurate and relatively unbiased tool before we use it? We need to be culturally sensitive about the communication we're sending out. And obviously laws and regulations like our HIPAA tools, our HIPAA regulations need to be met. Okay, so one thing to talk about is that the ethics part. So can a machine take responsibility? That's the question. I think the answer is no, but there's discussion around it still. So higher stakes are going to exist in medical practices. Like I've said before, if I make an AI screw up when I'm like ordering something on DoorDash or whatever, if the recommendation algorithm was wrong and I hate my burger, like that's one thing. But if the recommendation algorithm for a medication is wrong, that can have some pretty dire consequences. So that is where a lot of these ethical concerns are stemming from. And that's why we have to be vigilant when we're talking about utilizing AI and ensure that we're utilizing it in a responsible way. So it should be used to augment a provider's capabilities and not to replace them, because that's the best way we can fight against, you know, these biases, these failures. Okay. Patients are also going to have questions. Sorry, I'm speeding because I'm close to the end. I always talk more than I think I will. Patients will have questions and providers should have answers, is the long and short of communication mattering. You know, if a patient asks a question, even if it seems simple or obvious, answer them honestly, answer them transparently, and don't answer them in a way that makes them feel like lesser, like or dumb for not understanding. Everybody comes at things from different places, different levels of awareness and education. So it's important to be ready for questions. Okay, I've talked about security before, but be proactive, collect your patient, protect your patient data, don't collect it, geez, other than where you need to. Consult experts where you need to, especially if you're using large scale AI tools, and do make plans for what to do when the worst happens. We never think it will, but it does sometimes. Okay, so in our last couple minutes, let's talk about preparing for the future. Okay, legislation. There is no current specific regulatory pathway for AI-based technologies, but the FDA does regulate them or evaluate them under the same regulatory framework they do for medical devices. State-by-state regulations are being passed, and increasingly there is language there that's going to require providers to oversee and review the use of any AI tools used in clinical decision-making. So there is talk happening around it. All right, so ensuring that AI is sustainable, how we do this is that we utilize AI tools that have human-centered design. They are designed for the patient, for the end user. When we implement them, we work with our community to implement them in a responsible way. We find sustainable funding, be that working with other folks within the community or outside of it, or diverting existing funding streams. And then we continuously evaluate. No use using something that is no longer effective. Or maybe something is effective and we want to utilize it more places. We only learn that by evaluating. Okay, so one thing to note, AI in rural health, just like telehealth in rural health and everything else that I advocate for, it is not going to be a quick fix. It's going to require careful long-term planning to be effective in our communities. So a sustainable AI is going to require more than just like having a good algorithm to deploy. It's going to require community trust, inclusive design, ongoing support, and long-term commitment. It's not something where we can show up, throw an AI tool on everything, and then everything is fixed. That's just not the way it works. Okay, so where do we go from here? The future of AI, we need to ensure that we are being positive. Like, we shouldn't come at this from a stance of nothing will work. We should come at it from a stance of AI is an exciting opportunity that we need to utilize in a practical, responsible way. We need to remember this is always a tool. It's never a provider. And it can be utilized to enhance a provider's abilities. And also, last thing I want to leave you with, healthcare can lead the way in this, as can public health. So these are high consequence fields, but they're high visibility, high impact. So if we do things right, then that's a positive example for folks around us. And new emerging opportunities here are always going to be emerging. So takeaways today. AI is here. It's not going anywhere. So we got to talk about how to use it. And then it is our responsibility, if we are using it, to utilize it appropriately. And last but not least, AI is going to keep advancing. Not maybe as much as some of the commercials that I get for like this AI fridge will save your life or whatever may imply, but it's going to keep advancing. And the way we utilize it and think about it should as well. Okay, so I do want to put this up. If you could fill out this feedback survey. We as the UMTRC are trying to identify how we can do the best for folks going forward. So please use your phone, use the QR code, fill it out. We will be sending this out to folks in an email as well. So don't feel too stressed if you don't get it, but we would ask you to do this. All right, so I know we have one question. I've got 4 minutes. So do you believe AI will start costing people money, as in companies will have less publicly accessible free AI since money is going into its development? I think that's a really good question. I think AI is like any new technology. The usage of it, we don't have a crystal ball, so we can't see how this will necessarily develop, but any new technology is going to have some sort of cost. And in some cases, yeah, that might reflect back on the end user. But whether the end user ends up being the patient, the hospital, what have you, that still remains to be seen. And it also remains to be seen if the cost reflected back on the end user is going to be more or less than the cost that can be offset by replacing certain systems. So it's something where potentially yes, but also potentially it'll save more than it costs, if that makes sense. I know that's not a definitive answer, but unfortunately a lot of things aren't definitive in this process. Okay, so last but not least, this is all of our contact information. If there is anything you didn't get a chance to ask today, or if you have more questions for the UMTRC, please do feel free to contact us at info@umtrc.org. And then we also have a lot of different social media. We're really active on LinkedIn, but we also have a Facebook, a Twitter or X. I should probably replace that. And then we have a YouTube channel where we upload all of our old webinars. And then we also have a podcast called A Virtual View that I host. So if you didn't get enough of me today, there are more ways to hear me talk. Thank you so much for your attention today. I will hang out for a while longer if there are any more questions that folks might have. But beyond that, really appreciate you coming, paying attention, all that good stuff. Hopefully you learned a little something today.